Well, I do have a talk tonight, and we'll answer questions after. A lot of it was touched on in the documentary, but let's start with this one. Is all memory loss scary? Yes. But is all memory loss dangerous? No. Because all of us have memory loss at some point or another throughout our entire life. I got to remember where I parked tonight, right? So there are some normal memory loss, and I want to tell you a little bit about that so you can tell the difference between what's normal and not so normal. And so there is some degree that's normal, and let's say you forget someone's name, or maybe that actor on TV. That can be very normal because, well, even if you enter a room, the senior's moment, right? That is very normal, especially when you remember later what you forgot. You think about it, it's frustrating, the word or the name, and then you wait and it comes back later. I have to say that's a good sign when it comes back later because it's very normal. So if that happens to you, please take heart because we're all experiencing that. Because the memory was there, it just took longer to come out. So that's a very common occurrence with, getting older, but even stress, fatigue, sleepiness from a bad night's sleep can do that to you. Now, what is not normal, okay? So here is where critical, important details from recent events are completely forgotten. Like a special event, reception, a wedding, or something like that happened, went to recently, and forgetting critical details from that. That's very surprising to those around you who are talking to you. How could you forget that? And more so, if someone observes that you're repeating yourself after just 5 or 10 minutes, saying the same thing, even though you just got the answer to that question, asking it again and again every 5 minutes, not realizing that you received the answer. These are not as normal. This is where memory loss that other people notice in you, but you may not notice in yourself. And that is because you might be forgetting that you're forgetting. And that can happen. And that's not so normal. In the first situation with the normal memory loss, that's where you're worried about your own memory. But others, if you ask, they're not worried about you. So that's a good sign. This situation is where you're not worried about yourself, but others are worried for you. That's the scenario that may not be normal. And I always say, that could trigger maybe seeing a family doctor for a memory test, because those are not quite normal, and they're quite surprising. And they can come on over about 1 or 2 years, usually. So if that's the pattern that you're seeing in yourself or someone you love, that would warrant a memory test. Moving on, simple words, very simple words, surprisingly simple, forgotten. That may not be normal. Becoming lost, not venturing out into a part of Ottawa you haven't been in a while, but I'm talking about getting lost in your neighborhood, where you've lived for decades, or in your home. So that's not as normal, of course. How to perform daily activities which were previously done well. You see, I couldn't cook a meal today, but I never could. But if you were a master chef, or were very good at cooking, baking, and now over 2 years cannot get through the recipe, that's different, and that's not as normal. Solving problems, displaying poor judgment. Personality change, if you were always very quiet and now becoming very childish over 2 years, that's not really normal. Or the opposite, if you were gregarious and now very quiet, withdrawn. I see these symptoms every day, and they're not quite normal. It's a big change. And then if it starts to take away your function, see, that's clearly not right. So if could not manage medications anymore, shopping, bills, cooking, cleaning, driving a car, very important. And certainly dressing or hygiene. If there's difficulty with that, that's actually more advancing, in fact. All right, so what does this word mean? It was sort of touched on in the documentary, but let's go deeper. Dementia is defined as a memory loss which is enough to take away independence. So you have to have both, a memory or thinking symptom and losing some degree of independence. That's just the definition. So there's a mild dementia, which means you just need a little bit of help with independence, such as complicated activities like bills, meds, a little bit of help. That's mild dementia. Now, moderate dementia means now some help needed with dressing and hygiene, more basic daily activities. That's the middle stage. And then, of course, the severe stage is that you need help with everything due to memory loss. It's a simple structure there. Understand where this dementia can be mild, moderate, or severe, depending on how much help it has required you to receive. Now, what is Alzheimer's then? Is it the same thing? It is not the same thing as dementia. So Alzheimer's is defined as these proteins, which the documentary showed. It's the amyloid beta and the tau in the brain. If they are both building up in the brain, that is what Alzheimer's is. In fact, it's a biochemical process is what Alzheimer's is, defined by these proteins. And yes, we think these proteins damage the brain, causing dementia. So you see, Alzheimer's process disease is the most common cause of memory loss and loss of independence. So Alzheimer's is the most common cause of dementia. In fact, there are other causes of dementia. A stroke, which is where the blood vessel is blocked and you lose oxygen, that can cause dementia if it takes away memory. Parkinson's, a movement disorder. Head injuries, a lot about that in the news. How head injuries and concussions can cause dementia too. So dementia is like an umbrella or broad term, and Alzheimer's is this specific biochemical cause, which is the most common cause. That's why they're used a little bit interchangeably. But as you can see, they're not exactly the same. Alzheimer's is the cause, and dementia is the effect. And that's how they're truly linked. So the documentary talked all about those proteins, about Alzheimer's. And we'll talk about those as we come to research, which we'll finish. Now, this Alzheimer's and dementia, as you know, increases with age.
Andrew?
Yes?
Just use your mic.
Oh, is it? Sorry. Okay. And I wasn't sure if it was projecting. You guys, can you hear me now? Is that better? Okay, there we go. Thank you. So, with age, the prevalence of Alzheimer's goes up, and we know this. So by the time you reach the age of 85 to 90, so those 5 years, it's almost a 50% chance. And over 90, it is exceeding a 50% chance of having dementia. And this is because with age, the chances of amyloid builds up, as we'll talk about. But this is obviously a threat to our population, as was mentioned, because of the baby boom population, in which a large number of individuals will be turning 65 and older over the next 25 to 30 years. There's going to be a peak in this condition over the next 30 years. So the need is very great for us to find some treatments which can alter the projected curve of suffering in our society in Canada, but also around the world. So, like for example, in the US, it's obviously increasing such that it'll be approaching over 13 million individuals by 2050, nearly tripling from its current numbers. And in Canada, so about 500,000 now, and in 15 years, a near doubling to nearly 1 million people. And the population of Canada is 33 million. So it's significant. And the cost is, well, at least the Alzheimer's Society estimates a staggering number of the cost. That's the economic cost, to say nothing of the personal cost towards individuals and, of course, their families who are caregivers. This is something we want to change very much. So it all started 100 years ago with Dr. Alzheimer, as was well mentioned in the documentary. And in 1906, that's where he saw Augusta. And it was her brain that showed the plaques and the tangles for the first time. So the plaques are outside the brain cells, and the tau tangles are inside the brain cells. The documentary showed that one. For most of the 20th century, it was thought that this was rare, just of the young. And it was only by the 1970s, I suppose with increasing autopsy research, that it was shown, you know what, this Alzheimer's process is far more common than we realized. And that's when the research really started to increase. This is, we'll move through this quickly, but this is a diagram of how the amyloid is made at the wrapping, the cell wrapping of all of the billion brain cells that we have. That line in the middle is sort of the cell membrane of the wrapping around the brain cell, and this protein, which is the tube and twirl, is processed or cleaved or cut to form the amyloid fragment, which then leaves into the space between the brain cells. If there's too much of that, they start to bind to themselves in the middle, the oligomers as it's called, which then exerts a toxic effect on brain cells. Further, the oligomers bind into plaques, probably acting as like a waste dump for these smaller oligomers. It might be that the plaques are a way of the brain trying to protect itself by getting the more toxic mini collection into one big collection out of the way. But whatever the case is, you can see there's too much of this material building up. And that's what has led to what is called the amyloid hypothesis, which is what was talked about in the documentary. Is this protein the cause of it all? Well, we know that genetics, boy, that was shown in the documentary, can affect how much amyloid there is. Environment, by that I mean lifestyle and pollution, and of course age. Increasing age leads to more amyloid, clearly. And those families in Colombia, and some in Ottawa, have a mutation in their DNA, which they showed, that causes amyloid to be produced at 10 times the level. See, that's what fueled this understanding, is that research showed that mutation causes way too much amyloid to be made. So then it was thought, well, that must mean the amyloid is causing the disease. Because look, they're getting Alzheimer's in their 40s because the amyloid production has been ramped up by this mutation. That's what has fueled the amyloid hypothesis of Alzheimer's and all of the research studies they were talking about there. And how we're trying to remove amyloid from the brain desperately. And then it's thought that after the amyloid, it then causes the tau tangles to form second. And then it causes the brain cells to be damaged and die, and then is the dementia, the memory loss. So this forms all of the research that we're doing now. And it takes place over 10 years, maybe 2 years for the initial symptoms, and then a decade for this long goodbye, where all of the independence is lost. There may or may not be behavioral disturbances such as depression or agitation or aggression, not always, but it can happen, which then leads to long-term care placement and passing after a decade. It shouldn't have to be like that. No one should have to end their days like that. And that's why, that's the research we do, to stop that. And we detect it early, and we do this every day at Bruyére memory programs. We use these memory tests, which have been validated over decades. And a CAT scan, MRI of the brain, blood tests to rule out medical conditions and strokes and brain tumors to make sure we're not dealing with those. And we put it together to try to make a diagnosis. Is this early Alzheimer's, or is it not? Because about a third of the people we see, in fact, do not have Alzheimer's. We're able to give reassurance that the memory concerns are not Alzheimer's and may well be due to getting a little older, coupled to mood depression, sleep disorder, or other medical conditions which can be treatable. So that's our first step here, is to determine who has early Alzheimer's and who does not. And as you saw in the documentary, a new technology has arisen where, with an injection of a special dye, it goes into the brain, sticks to that amyloid, those amyloid plaques which are distributed throughout the brain, and then creates a picture of the brain in a living person to show that the amyloid is present or not. So on the left, it's dark because there's no amyloid. That's good. On the right, there's lots of amyloid. It's lighting up, and that gives us the information that previously was only available in autopsy in Alzheimer's time, and for all of the 20th century, we had to wait for autopsy to see if amyloid was there. Thanks to this technology, we can now detect amyloid in a very living person and allow them entry into a clinical trial which aims to remove that. And the documentary was showing scans that with those antibodies, you could actually lower the amount of red and yellow by clearing out of there. And we pray that that will also help memory. And all of the trials that they talked about in that study, we are part of, and they're all underway. So in fact, that documentary, even though it's about a year old, is still up to date in that we don't have any new information. All those studies are still underway. And here was another thing they mentioned. This is another injectable tracer that it doesn't stick to amyloid, it sticks to the other one, the tau, the tangle. This is a tau PET tracer. And so now you can see where the tau is building up. It's very powerful, and it's going to allow us to detect Alzheimer's earlier, maybe even before there's any symptoms. And they showed that in the documentary. They're trying to treat individuals who have no memory loss, but have amyloid and tau in their brain, in hopes of stopping the disease before there are any symptoms, maybe such that those individuals would never have to experience symptoms in their life. That's the dream. Treat it before there's any symptoms, and then you won't have to experience the symptoms in your lifetime. Is that sort of like a cure? Well, maybe, because they won't have to suffer in their lifetime. So do we treat Alzheimer's today? Yes, we do. We have medications, but they're not cures. We have symptom treatment. And you may have heard of some of these. They come as pills once a day or a skin patch once a day that delivers a medicine that does not target the proteins. These medicines simply boost brain cell output, like turning the volume up on brain cells. And they've been with us for 20 years now, these medicines. I'm sad to say we haven't found anything newer. That's the problem. We'll talk about that, is that we don't have anything newer than this yet. For mild symptoms and then for moderate symptoms, another medicine called Memantine. These medicines perhaps slow the rate of, they may slow the rate of progression or delay the worsening by 6 months to a year. It's something, but we know it's not enough. Our current treatments are not nearly enough, and that's why the documentary was saying we need more. Now, can we prevent this in the first place? Well, we can do a lot, because if we try to increase circulation of blood in the brain, that might help with flushing of those proteins out. And so that involves the circulatory risk factors like blood pressure, cholesterol, diabetes, smoking, weight loss, and lifestyle of physical activity like walking, mental activity like hobbies, socializing, balanced diet, the Mediterranean diet, with whole grains and low processed salt and sugars, olive oil, light meats, all those things that we've heard about that can help the heart and brain, they help prevent Alzheimer's. So we strongly recommend these things because they can delay onset and in some prevent. And in those affected, having a healthy lifestyle can slow the rate of change. So here's one more reason to have a healthy lifestyle. Sleep, I'm always looking for sleep apnea out there, because snoring, stopping, breathing while you're sleeping, it impairs sleep quality and oxygen to the brain. That can contribute to risk of dementia. I'm always watching mood, because that can accentuate memory symptoms. They can mimic memory symptoms and accentuate them in the case of Alzheimer's. And of course, I'm always trying to optimize vision and hearing, because the more that you see and hear, the better chance you have of remembering. Does it run in families? Well, we certainly saw some very dramatic families. But what about the general population? Yes, it can run in the general population. We just don't have any of those clear mutations in the general population, where family members will have a 50-50 chance of getting the same early onset. That doesn't affect the majority. But there are genes which run through the general population that increase risk. And so yes, having close family members who have had Alzheimer's does raise risk for other people in the family, in the general population. But the truth is, the risk increase is only small. So I tell individuals, family members of those who have had a few people in their family affected in later years, that their risk in themselves or their children is increased, but only in a small way. So really, fearing that Alzheimer's is inevitable in the whole family is not justified. And really the best thing to do is to have that healthy lifestyle, the positive outlook, and that is the best thing that anyone can do to decrease their risk. Anything in the environment, like our water supply, our food supply. Well, aluminum was once brought up, but the truth is that was never proven. It was never corroborated. So the aluminum risk has been dispelled, and in fact, no clear environmental risk factor has been identified. So we just defer back to the healthy lifestyle. Let's try to have the healthiest life we can to increase circulation, prevent heart attack and stroke, and flush those proteins out of the brain. HRT, well, as you know, in the 90s, before many women were on hormone replacement therapy as a general preventative, that's no longer done because of this study, where in fact it showed that for everyone over 65, being on HRT actually increased the risk of dementia, possibly because it increased the risk of tiny strokes in the brain. So as you know, hormone replacement therapy is not used anymore as a blanket preventative, but more so in younger women who potentially have had removal of the ovaries, or women who've had significant menopausal symptoms. They can be very helpful, and in those cases it's still recommended, but HRT is no longer a blanket preventative. What about in men? Well, the testosterone replacement therapy is important if testosterone is measured as low, if there's a significant loss of energy, libido, those specific symptoms, this can be helpful, but testosterone is not a preventative for Alzheimer's or memory loss. I may have looked. It's not the case. MCI, mild cognitive impairment, if you've ever heard of this, it's simply memory symptoms where there's no loss of independence. You may remember the definition of dementia was memory loss and loss of independence. This is simply another term of memory loss, but still independent, still driving, still working, but yet there's memory symptoms noticed, and we do a little memory test, we might find something. Why do we even try to detect this? Well, because there's risk of dementia later. If someone has this profile, there's risk of dementia later. Plus, if you were wanting to use one of those experimental medicines, where would you want to use it? Here. At the earliest possible stage. Use treatment at MCI so that you can try to prevent the dementia. But as you saw in the documentary, they're even thinking, why don't we try to treat even before there's any symptoms? So they're looking at treatment at all possible stages. As well they should, because we want to find something no matter what it takes. So anyone with MCI, and of course our clinic detects MCI every day, we offer closer follow-up over time. And of course, if desired, the research involvement. And here it is. Is there hope? Well, you saw in the documentary there is, because there's an enormous worldwide effort to find new treatments on multiple different fronts. And it's all about targeting those proteins that Dr. Alzheimer described 100 years ago. So, as mentioned in the documentary, one of the major efforts is the anti-amyloid antibody. You saw some individuals getting that treatment intravenously in the documentary, and we give that treatment every day here at Bruyére, at the Clinical Trials Unit. Here's the amyloid fragment. There's the antibody. I think the animation in the documentary was a lot better than that. And you can see it was sticking. And then the cells, the white blood cells, were actually almost engulfing the protein to destroy it. Using the immune system, which normally fights off viruses and bacteria, actually now fighting against or removing excess amounts of that amyloid fragment before it can damage the brain. So phase 3, you heard of the word phase 3. Phase 3 is the final stage. Thousands of individuals across the world, including some here in Ottawa, and if it's successful, that would then allow the medicine to be on the market, where it would be available to the general public. And so here, the first two were mentioned in the documentary. They go by these strange names, and of course we are testing those two, not the third one, but those two mentioned are being tested today here at Bruyére. And you also heard the documentary mention the next step. If the anti-amyloid treatments are unable to stop the cognitive decline, and I have to say, it is sobering to know that in the last 10 years, since I've been here, all of the clinical trials in the last 10 years have failed. All. And that is why you've not heard of any new treatments for Alzheimer's in the last 10 years. Because we've been doing these trials for 10 years now, and they have all failed. As the documentary said, with each failure, you try to learn and try to refine the trial for the next phase. Now they're using more of the PET technology to find out who has the amyloid before they enter a trial. They're trying to test the earlier, milder conditions like MCI, and they're trying to increase the dose, as was shown with that Biogen example, to try to get even more effect, while hopefully not causing side effects like the swelling in the brain that they mentioned. We do not want that. And so we're always checking for that, but isn't it sobering to note that there has been a decade of failure? And that I've had a front row seat to that, and it has not been enjoyable. I have been thanking all of those participants who have given their time to be part of our research, but I have been very disappointed, as has the research community, that we have not been successful in the 10 years. But there are more clinical trials today than there were 10 years ago. So instead of backing off from this research, in fact, the world has moved forward, and we've increased the number of research studies. Thank God, because we can't give up on this disease. In fact, there's more need now than there was 10 years ago, and there's going to be even more need 10 years from now. So while there's been failure, we're moving forward not just on the amyloid front, but also on the tau front. These are the tangles, of course. As the documentary mentioned at the very end, anti-tau antibodies are now ready to go into clinical trials, and I'm pleased to say that a phase 2 study will be starting right here at Bruyére in 2018 and around the world. That's right, because that's the next step. It's a privilege for me to work with the team at the Clinical Trials Unit, because we're able to bring these state-of-the-art treatments right here to Ottawa. And I'm also privileged to work with all of the participants who give their time. As was mentioned in the documentary, those individuals who come to the clinic and give their time to research are desperately needed, because there's no answers without. And so if you or your family are ever affected, think about the research, because we need individuals. We're always looking for those individuals who are motivated to do the PET scan, to take a medicine, and to do the memory tests for 1.5 years. And sometimes visits can be once a month. Not more than that, thankfully, but it can be a lot, and we're thankful for that. But as you can see, the reason we do it is very important. And we want desperately to find the treatment so that one day we can give it to the public. Other investigations. These are oral medicines. You saw intravenous medicines. We got oral ones too. These secretase inhibitors are a pill taken once a day that in fact blocks the formation of the, I showed that this is where the amyloid is actually made. So this pill actually just stops it from being made in the first place. The antibodies try to clear it. These pills actually just try to prevent it from being made in the first place. Those are currently underway right here at Bruyére as well. Growth factors, stem cell research. We're not doing them in-house here. You've heard a lot about stem cells. They've been held back because of ethical concerns, because they were derived from embryos. I'm very pleased to say that stem cells can now be derived from our own bodies. And so if that continues to develop, I see a future for stem cell research which is not encumbered by the need for embryos or placenta, rather from our own bodies, stem cells which go into the brain and become new brain cells. Wouldn't it be amazing to try to use a combination of the amyloid treatment and the stem cells so that we could stop the formation of the amyloid and allow brain cells to recover? A combination approach, which is definitely a very hot topic. Also under investigation, this is actually very much in-house. In fact, we had a meeting very recently announcing a new research hub here in Ottawa for technology here at Bruyére. For example, a computerized memory test, trying to use the power of a computer to measure memory more precisely to potentially detect the disease sooner. So we've got that underway, but more. At-home cognitive stimulation and testing. Imagine someone at home playing a computer game to stimulate their mind, but it also generates some data that can be shared with the doctor at the next visit. So you get better surveillance of someone's memory. And how about this? Sensors. This is a huge focus right here at Bruyére. Sensors in the home to allow someone with memory loss to function more safely. For example, a sensor under the bed that can detect if someone has gotten out of bed at night, which then triggers the house, to turn on lights towards the bathroom. And if the person wanders, potentially even out of the room or out of the house, further sensors will alert the caregiver and bring them back in. But that's just the tip of the iceberg. The potential for technologies to be incorporated into someone's house to allow for safer living with memory loss or any condition, you can imagine the potential there. And I'm proud to say that Bruyére is actually at the forefront of technology in memory. This partnership with U of O is actually spearheading this even further, because the combined resources of these institutions can generate the resources required to make all of the research you've seen tonight happen. So we're so pleased with that collaboration. We're hoping for more collaboration in the future. Here we are at BMP, we call it, Bruyére Memory Program. Fully covered by OHIP. We get referrals from family physicians mostly, but any physician can refer to us. We do, of course, the memory testing I was talking about with nursing and neuropsychology. Of course, we see the physician like myself to try to put it together to determine, is there Alzheimer's or not? And again, not everyone has it. And we're happy to give that news. But if there is mild cognitive impairment or mild dementia due to Alzheimer's, we make a plan. We offer the treatments that we currently have. We obviously offer access to the clinical trials we've talked about, you've learned so much about tonight. And all of the research, we offer access to all the research we're performing on technology and beyond. We try to arrange access to community services so that individuals and their loved ones and caregivers are not alone. They shouldn't feel isolated, that there are these community groups that help us, like the CCAC, the Dementia Alzheimer Society. And we provide follow-up, of course, because the condition changes over time. We're trying to get our wait time down to 3 months. We're not there yet. But we're pleased that new physicians are joining our group, and we are expanding. As you can say, that's a good thing, but maybe not a good thing, because it shows the need is so great. But we're committed to responding and expanding, especially in the next 30 years. You can see how the next 30 years will be a very important time for the brain, for society. And I'm really hoping that one of these clinical trials, or more than one, will be successful in that time. Hopefully sooner rather than later. So to conclude, we know that this dementia, memory loss, and loss of independence due to Alzheimer's, which is the buildup of amyloid and tau, is a threat to us, to individuals and their families, and all of us as a whole in the next generation. We have current treatments like they were called cholinesterase inhibitors, those are pills that are currently used, memantine. They only have a modest benefit. They may delay time to serious disability, but only by a little, 6 months to a year. They're worth trying, but they're not a cure. We need more. And of course, we recommend a healthy lifestyle because it can delay onset and delay progression. And lastly, treatment of these proteins, amyloid and tau, is currently being tested very rigorously around the world, and of course right here at Bruyére. And so if one of the current treatments, all of those trials you just heard mentioned, any of them are successful, then yes, we're going to have new treatments even in the next 3 years. But as we've seen in the last 10 years, there's been a lot of failure. So if there continues to be failure, we may have to wait longer. And so I don't know if there's going to be new treatments in 3 years, or will it be 5 years or 7 years. And as I say, we desperately want this to happen sooner rather than later, so that individuals and their families will not have to suffer the ravages of memory loss. Thank you very much for your attention.